This is the Good Neighbor Podcast, the place where local businesses and neighbors come together. Here's your host, Cabo Jim Schaller.
Welcome, good neighbors, episode number 144, the Good Neighbor Podcast Estero. Today we have good neighbor Melissa Wood from Lee Health, the Heart Institute, the Heart Institute, the Chief Physician Executive. I think I got all that right.
You sure did.
Sorry about that. Welcome. Pleasure to get to know a little bit more about you and what you guys do over at the Heart Institute. So let's jump right in, and why don't you start off by sharing a little bit?
Sure. Well, thank you, first of all, Jim, for inviting me to be part of the podcast. I live in Estero, near Estero at Miramar Lake, so I'm really excited to be sharing something with my good neighbors. All right. I moved down here to the Fort Myers area in July of 2023. I am a cardiologist, and I spent the last almost 25 years of my career at Massachusetts General Hospital in Boston, and I moved down here to help develop a Heart Institute at Lee Health. And so I'm really excited to be here and looking forward to improving the heart health of our community.
Absolutely. That is great. So is that what brought you down here? Why'd you pick Southwest Florida of all places?
Well, first of all, I love Southwest Florida. We've been coming down here for a long time to vacation. And I have always thought at some point I would relocate to this area, but also, when I found out that there was a position to take the leadership role and really help build the Heart Institute, I was extremely excited because it really brought together a role that I am absolutely ready to take on, and the ability to do it in a place where I really wanted to live, for me, was just a once-in-a-lifetime opportunity.
Right. The best of both worlds, which is a good opportunity. So let's back up your story a little bit. How did you get involved in this industry to start off with?
So I went to medical school. I grew up in a small town in Missouri and went to medical school in Kansas City, and then went to Boston, out to Harvard Medical School for all my postgraduate training. And at that time in the 1980s, very, very few women went into cardiology for many reasons. And I saw it as a field that I knew was going to be challenging, but something that I was totally excited about going into, because in the 1980s, we were beginning to see some very new treatments that really revolutionized people's outcomes after heart attacks, and new procedures that helped us both treat and prevent heart disease. And so for me, there was no question what I wanted to do once I got into my medical training. And I've been fortunate to be able to not only do some really cool research discoveries, how the heart, responds to exercise, how women's hearts and men's hearts respond differently in different settings. But also I learned how to be a leader and how to understand the dynamics that the really situation in medicine today is rapidly changing. And, for me, I thought the next frontier is really bringing cutting edge care, clinical research that helps improve the care of a community to a community like Fort Myers, because we know there's so much growth here, and we have a really interesting and very diverse population that would benefit greatly from some of these new technologies and new approaches to care.
Absolutely. So we've all had some type of challenge along our journey that maybe helped define us. Is there something that happened along your journey that you can look back at now and say, you know what, I'm not necessarily glad I went through it, whether business or professional or personally, that, kind of shaped you?
The way I look at it, I kind of hope that for all of us, those little challenges along the way make us a stronger, healthier, and more resilient person. And I think for me, the challenges really probably started out with being in a field where there were very few others like me. I was someone who really valued balance in my life, and I valued taking care of myself and those around me. I was working very early on with lots of people who were so driven they didn't take good care of themselves. And I had to work hard to help them understand why it was so important. That was a challenge. It wasn't an adversity. I then, really wanted to balance being a mom with being a physician. And that isn't easy under any circumstances. But, I really embraced it. And I have 4 adult children. In fact, my second child graduates from medical school on Friday.
Congrats.
To balance all of that, I had to learn equipoise. I had to learn that you can't have everything, but you can have the things that matter to you at different phases in your life. I also, had to deal with being single. I went through a divorce, and I think that is tough, but it also allows you to learn and to empathize with others who have similar challenges. And then having aging parents and going through being in the sandwich generation when I had young children and aging parents, and learning how to help each of them, but to also remember that whole oxygen mask thing. If you don't take care of yourself,
Yeah.
take care of those around you. So each of these experiences, I think, made me a stronger person and made me a better physician for sure.
Absolutely. I love that. So, are there any myths or maybe misconceptions surrounding what you do that we could clear up for our listeners?
Well, I think the first myth or misconception is that heart disease only happens to, elderly people. And that misconception is important. I want people to know if you have a new symptom, whether it's chest discomfort, pressure in the chest, lightheadedness, dizziness, get it checked out because it can happen to anyone at any age. I also want people to learn hands-only CPR. It's really easy. There's the heart.org website will help you figure that out. We hear every day of people on a pickleball court, on a tennis court, on a basketball court, they go down. Doesn't happen frequently, but it happens around the United States. And when that happens, you want to be able to do those compressions, have someone get the AED to save their life. That's just something I feel anytime I speak publicly, we have to remind people because it can make a huge difference. From the myth perspective, I really want to point out that, when we're trying to lead through change, it can be really tough, whether you're in business, whether you're in medicine, whether you're in other service industries. And the only way we can really help people get through changing times is to communicate, to be humble, and to know that sometimes we're going to have misses and hopefully most of the time we're going to have wins, but you have to maintain the connection with the people you're leading. Oftentimes administrators, especially in medicine, can get a little bit of a tough reputation because we are the ones that are trying to sort of identify new ways of providing care. But I want the listeners to know that, at least for me, and I think many of my colleagues here at Lee Health, we lead with heart because you really have to lead knowing that you're doing this work for the patients. And that is ultimately the goal. And if we keep that true north, then I think people can really understand when we have to make tough decisions, because this isn't an easy world to be in today, especially with all the changes in medicine.
Absolutely. Speaking about changes, do you see anything trending within the industry and what you're doing?
There are a bunch of trends. I think from a heart perspective, I will say the trends are using our smart devices to help us have better health, whether those are smart watches, smart rings, other devices. And we can use those data really to help us sleep better, exercise more, and to really remember to take care of ourselves. So that's a trend that's positive. I think from the healthcare landscape perspective, there's been more of a focus, especially since the pandemic, on alternative ways of accessing care because access is tough. We don't have enough healthcare professionals, and we have more and more people who need our services, whether it's cardiac care, behavioral health, primary care. And so one of the big trends is blending virtual care with in-person care and finding that right mix and figuring out how can we connect with our patients, but still provide high quality care. That's really on the uptick. And then finally, thank goodness, there's finally an emphasis on prevention. That's really helping us have healthier lives before, the hammer strikes and we have a heart attack or a stroke or heart failure, and focusing more on how we can educate patients to eat right, to get that exercise, to get the sleep, to take the meds if they're needed, and to really manage their health and be partners in their health. Because we know that if you just go along and don't pay attention to some of these important numbers, you will end up with an unfavorable health outcome. And finally, insurers and health organizations are really putting more effort on getting out into the community to educate so that we can help people have healthier lives and try to avoid a lot of the health issues that have been so prevalent and unfortunately are still on the rise in the United States, like heart attack, like diabetes, like obesity and stroke.
Absolutely. It is about that preventative maintenance and stopping it before it actually happens. So on a personal note, I know you grew up in the Midwest, you went to school in the Northeast, you're in Southwest Florida. What do you enjoy doing outside of work?
Well, I will tell you that having moved to Southwest Florida, I think I'm the healthiest I've ever been. You name it, and I'm happy doing it. It's, again, I walking in the evening. I ran this morning. I try to get in those 30 minutes at least before I go to work. Hope to get in some pickleball tonight, walking my dogs, being out on the water. I don't have a boat yet, but eventually would love to get one. Just enjoying that. And then, in my downtime, I really like to read. I like to read things that help me learn how to really listen and learn to those around me and take better care of myself. I also love mysteries, and I think those are sort of a fun thing for me to do. I wish I could say I enjoyed cooking. I don't, but I enjoy a lot of other things.
There you go. Plenty of nice restaurants to go out and visit. That's it. Absolutely. So is there one thing you wish our listeners knew about what you do that maybe they might not be aware of?
Absolutely. I would love them to know that I am here, that our Lee Health Heart Institute team is here. If you have a group organization, you want someone to come and talk about heart health, not branded, not promoting an organization, just talking about what we can do to make you healthier, we will be here to do it. We have a whole team of nurses, nurse practitioners, PAs, physicians. I love to speak. I speak at Coconut Point sometimes, for the community. You can reach out. I'm sure they can find us through your podcast or other ways. Because I am truly committed. My goal personally is to helping improve the overall health of Southwest Florida. The cardiovascular health, certainly, but if you take care of your heart, the rest of your body gets to enjoy the ride as well.
Absolutely. So how would our listeners go about getting in touch with you if they wanted to learn more or needed to come visit?
Sure. So I will share my administrative assistant's email. And her or phone number. I can do that, either one. But Jennifer.Moroney, Moroney, at leehealth.org. And she manages my schedule and can help listeners identify whether they want to set up an appointment with one of our amazing physicians, whether they would like one of our team to speak. Again, community education is the heart and soul of what I believe that is the way we can change health. If you want to talk to us about, anything else, just reach out, because again, I'm really here I want to spend the rest of my life in Southwest Florida. So I absolutely have a stake in the game to make this an even healthier place.
I love it. Melissa, thank you for being such a good neighbor. It's been a pleasure getting to know you, and I hope to see you out in the community soon.
Thank you, Jim.
Thank you for listening to the Good Neighbor Podcast Estero. To nominate your favorite local businesses to be featured on the show, go to gnpestero.com. That's gnpestero.com or call 239-296-2621.